Mouth ulcers are very, very common. And why do we get these ulcers? By and large, the most common reason could be a traumatic bite. If you have bit your cheek or bit your lip, then you get an ulcer, which can be very painful, and it lasts usually for a few days and heals. The second most common reason why you get ulcers is because of the fact that there could be a lot of stress in your life. If you're stressed out, if you have a lot of tension, then you can get ulcers, and these ulcers are called as aphthous ulcers. Occasionally, when there are nutritional deficiencies, if you are anemic or if your protein in your body is less, then there is a possibility of getting these kind of ulcers. Another very common reason why you can get ulcers is if you have infections. It could be bacterial infections or it could be viral infections. Sometimes when you have herpes, which is a viral kind of infection, you get multiple ulcers, and occasionally it could be only on one side of your mouth or your cheek, and that is called as a herpes zoster ulcers. All these ulcers usually heal within about maximum 10 days to 2 weeks time. If these ulcers last for more than 2 weeks, then it is important that you get checked by your doctor or an expert like a maxillofacial surgeon. The reason is occasionally you can have mouth cancers, and that could manifest itself as a non-healing ulcer. If you have a habit like smoking, or it could be even chewing pan masala or gutka, and if you have an ulcer, then we are concerned and we would do a biopsy in such cases. So if you have an ulcer, if it heals in maximum 2 weeks time, then don't bother about it. But if it persists for more than 2 to 3 weeks time, see a specialist, see a maxillofacial surgeon, or come to us and we will sort it out for you. Hello, I'm Dr. Girish Rao. Oral cancer or mouth cancer is extremely common in the Indian subcontinent, and that is because people, unfortunately, in India have a dirty habit of chewing pan masala or gutka, or in the village side they use tobacco leaves or tobacco sticks. This is in addition to a lot of people who smoke. It could be BDs, it could be cigarette, pipe smoking, or today even vaping. Now all this tobacco and its products, when some people also take excessive alcohol, then these factors get compounded and can cause mouth cancer, it can cause throat cancer, or it can also cause lung cancer. Nearly about 30% of all cancers in India is head and neck or mouth cancer. What are the common signs and symptoms of mouth cancer? Unfortunately, mouth cancer in the initial stage is totally without any symptoms. You may not have any pain. There could be a small ulcer or a small lump which is there in any part of your mouth. It could be in the lip, it could be inside the cheek, which is called as the buccal mucosa. It could be in an area where the gum is there around the tooth, or it could be if you have undergone a tooth extraction, the socket, that is the jaw cancers which you can get. You can have it in the tongue, or it can be in the floor of the mouth or in the palate, which could be the front part of the palate or the back part of the palate, which is called as the soft palate, or it could be even in the back portion of the throat, in the tonsillar area or at the back of the throat. So the initial symptom could be a non-healing ulcer. You have an ulcer which has been there for more than 3 weeks, then we are highly suspicious that it could be even malignant. Or it could be a lump or a swelling in the jaw or in the tongue, which could also be an initial stage of cancer. Cancer, if it is left untreated, starts growing and then it starts spreading into the neck. This is called as regional spread. So it could be on one side of the neck or sometimes even to both sides of the neck, where you have lymph nodes and these nodular structures become hard and it's palpable to your fingers. So this is a second stage of cancer where from the mouth it is spread into the neck. And if it is left like that, it can spread to the other parts of the body and it could be to the lungs or to the liver or to your stomach or to the brain. That is very, very advanced cancer. So cancer or mouth cancer in the initial stage is totally without any symptoms, and that is the reason why if you have a habit, which could be a smoking habit or chewing of tobacco in any form, and if you have an ulcer which is non-healing or a lump which has been there for more than 3 weeks, please come and see us as specialists and we can help you. What do we do when you have an ulcer or a lump which has been there for a long time? The first thing which we need to do is a good thorough clinical examination. We might do some radiographs, x-rays, dental x-rays, a panoramic x-ray, a CT scan, an MRI scan, or sometimes we also ask for what is called as a PET scan. Once we get these investigations done, we would also run a few blood tests, and after that we do a biopsy to confirm whether it is cancer or not. So biopsy is where we take a small piece of tissue, a representative sample of your ulcer or swelling, and we send it to the pathology lab to confirm whether it is cancer or not. But a thorough clinical examination is very, very important. Unfortunately, many a times even before you get cancer, you can get what is called as precancers. So you can have a white patch, could be in the cheek or inside the mouth, in the tongue or in the lip, or it could be a red patch, or you might have sometimes a diffuse condition inside the mouth which is called as submucous fibrosis. Now here the mucosa, which is the inner lining inside the mouth, which is soft and supple and pink, tends to become very hard like leather, and you get severe burning sensation and intolerance to spicy food. Your mouth opening also, because the cheek mucosa is very firm, tends to become restricted, and a lot of patients come to us with difficulties in opening their mouth. This is also a precancerous condition. So if you have an ulcer, a white patch, a red patch, or difficulty in opening your mouth because the cheek inside is all very, very firm, then we are highly suspicious that it could be either a precancer or a cancer itself. And it is important that if you have these kind of situations, please come and get it checked by a doctor or a dentist or a specialist like us.